I didn't know how many people here would be professionals versus lay people, so I have to do a blend to try to distill down some science to show you that everything that I'm going to show you tonight is scientific to the standards of orthodox medicine, but I have to have you understand it as well. So this talk is entitled Ozone Therapy Collective Research from two researchers across oceans, Vilio Bacci and Sylvia Menendez, and me as a clinician. This is my quote: with the exception of diet and nutrition and detoxification and stress reduction, take those three out, ozone does more good for more conditions than anything I've ever seen in my entire professional career combined. I hope you'll see it. In the news this week, antibiotic resistance. World is on the cusp of a post-antibiotic era. All the key players are in place to make this world a post-antibiotic world. A catastrophe is right in front of us. It's unfolding now, and it's unstoppable. Rowan note, we're returning to the pre-antibiotic era. The conditions we take for granted as easily treatable now, we're going to have a crisis. In fact, we're having crises, and there will be crises in this hospital. You know that. So I'm going to start with just a couple things on infection, and then I want to move into what happened in Africa. This is the effect on ozone on rat survival in a model of peritoneal sepsis. For the layman, what they did was they took out fecal material from the intestine of the rat, put it in their abdominal cavity, and would see how many would live. What they did was they gave ozone to the rats before they put the SH into their abdominal cavity. And the ozone alone, before they did it, resulted in a 62% survival compared to 7% survival in those that they didn't pre-treat. In this particular case, if you give ozone, this is called tumor necrosis factor alpha. I don't expect the layman to be familiar with that, but it's a nasty cytokine. It's indicative of vicious inflammation in the body. Steroids will bring it down with brute force, which you don't really want. So here's tumor necrosis factor alpha. This is if you give dexamethasone, it knocks it down 100%. And here's ozone, and just rectal ozone. Just rectal ozone. This form of ozone, they actually shot the ozone gas into the peritoneal cavity. This is letting you know what an incredible anti-inflammatory compound this is. So what is ozone? It's O3. We breathe O2. That's what's in this room. It's not a poison gas. It is made by lightning or ultraviolet splitting apart O2. One of the oxygen careens into another O2, and it makes O3. Medical ozone is a gas mixture of about 95 to 98% oxygen and only 2 to 5% ozone. Ozone has some stability due to its chemical nature. It lasts about 30 minutes at room temperature. If you put it in distilled water, it will last much longer. If you freeze it, it can last for a couple days. And if you put it in vegetable oil, it will last for years.
Olive oil,
like olive oil, right?
You know, yeah.
Many oils.
Okay.
Ozone has been used to treat more than 134 serious conditions. Here are some of them. I'm not going to read them all, but I will tell you that I've treated 95% of what's on here, and generally with incredible success. We'll go through a couple of the things. I've treated MS, I've treated strokes, rheumatoid arthritis, scleroderma, multiple sclerosis. Fungal and yeast conditions is really easy. We're treating an autism case now who seems to be getting better, and I treated another couple autistics who got a lot better. That's my phone, and they're going to have to wait. So many different conditions. Well, we treat Lyme, CFIDs, multiple chemical sensitivity, even depression. These conditions are really, really difficult to treat. How can this do this? Well, Vilio Bacci, an Italian researcher, sought to find out how ozone could do this. Why were the ozone doctors saying we can help all these conditions? Well, the bottom line is all healing flows into one road, oxygen. That's the bottom line in healing. Either you have oxygen or you don't. Because if you don't have oxygen, you're not going to make energy. It is oxygen what drives any and all healing by being the means of energy production, and it creates ATP for repair and regeneration. If I talk over your head, just raise a hand and let me know that I am.
What's ATP?
ATP is adenosine triphosphate. It is the chemical that stores your energy. In other words, if I pick this up, ATP in my cells is creating the energy to defy gravity. Oxygen is needed to manufacture that. Oxygen is the source of all energy. It's the source of the immune cell's ability to kill organisms. When you incur an infection, like what's killing people, your immune cells will burn 100 times the amount of oxygen at that moment, then it rests. It's called a respiratory burst. If the oxygen ain't there, you ain't going to make it. It's like you stepping on the gas to power your car when faced with an invasion of a yellow light. You're giving your engine that much power because of the yellow light invasion. Ozone is the most powerful naturally occurring oxidant. An oxidant is a molecule that is seeking an electron. It will grab an electron. Oxygen seeks electrons. Now, what might it attack? It's looking for something electron rich. You've all heard of unsaturated fatty acids, right? And this was saturated. There's only one bond between two carbons. That's 2 electrons. This is unsaturated, where you have a double bond and there's 4 electrons. This is where the ozone wants to go. That's easy pickings. It's just going to grab it. Here's an ozone coming to a fatty acid. It wants those electrons, it grabs it, and then it breaks up the molecule into reactive oxygen compounds. Notice O, 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 O. Those are called peroxides. They're reactive oxygen molecules. Ozone only lasts seconds in the blood. These guys will last hours and days, creating secondary chemical messengers and effects. In fact, hydrogen peroxide is well known as one of the most important chemical messengers in the body. Now, you're going to say, aren't we supposed to be scared of oxidants? Right? Everybody says that. Free radicals. Oh, we need to use antioxidants. Wrong. That theory's been decimated. In fact, your body right now is in a chemical balance of all kinds of very powerful oxidants, and if it wasn't, you'd all be dead of infection. This is superoxide, hydrogen peroxide, the hydroxyl radical, nitric oxide. Everybody knows nitric oxide is the Viagra stuff. This is sodium hypochlorite or bleach, singlet oxygen, O3 ozone, and peroxynitrate. All these are in a constant state of flux, including ozone, and you'll see as we get on, ozone is actually made in the body. So what happens? We give an oxidative stress like ozone, and then the body has to respond to that stress, and it does so by gene expression, making new synthesis of antioxidant enzymes. How do you make your muscles stronger? Silvano and I go climb hills every weekend. So that makes our legs strong by working the muscles. They get stronger. If I work your antioxidant system, I'm going to make it stronger. So knowing all this stuff led me to consider what ozone might do for Ebola. Well, the Cubans have shown that ozone can spare a rat of carbon tetrachloride liver wipeout if you precondition it. Carbon tetrachloride will destroy a liver. It can help with diabetes, it can help heal burns, endotoxic shock, I showed you that with bacteria, kidney toxicity, lethal peritonitis, all of these, and they're mediated by what's called reactive oxygen species. Here's an article that says ozone preconditioning, if you give ozone to an animal before you damage its liver, it protects it. Now, this is very interesting. This comes from Cuba. Most of the healers in here know what anti-inflammatory drugs are, like NSAID drugs, COX-1, COX-2 inhibitors. This is an expression of COX-2 without ozone, and if with ozone, ozone knocks out that pro-inflammatory enzyme. Probably far better than any NSAID drug you get, and you don't burn up your stomach doing it. So it attenuates inflammation. This is what your blood might look like if you're sick. All the blood cells come together, they clump. With ozone, they separate. You can see this under a microscope. This is very important. Ozone, for the healers, shifts the oxyhemoglobin curve to the right. For the layman, what that means is it enables your hemoglobin to release its cargo of oxygen in your tissues. And it does so with a compound called 2,3-DGP. If that's not present, you will be fully saturated with oxygen, but none of it will be released to your cells. It's not going to do you any good to have red blood if it's not being released to your cells. So what does ozone do? When you give ozone, it increases 2,3-DGP, but it does more than that. This is a Cuban slide, and it shows that if you give ozone, this is an increase in the capillary arterial side pressure of oxygen. So the arterial oxygen pressure goes up, the venous oxygen gets lower, and here's your spread. Arterial oxygen up, venous oxygen lower. What does that mean if the venous side is not returning as much oxygen? Yes, it's being burned. And there's your Cuban research and German research. This to me is the most incredible slide because this was your energy production before ozone. This is your energy production lasting weeks and weeks after you get ozone.
You can't do that with oxygen?
No. No. We can talk about that at the end. Now, before we look at further basic science, I want to take you to a journey to Ebola land. And why? Why ozone for viruses? Viruses have two key structures in their membranes that might make ozone a good target, a good bullet for it. Here's an article talking about Norwalk virus, poliovirus, and another one using ozone disinfection in water. Overall, the results of the study indicate that Norwalk, as well as other intestinal viruses, can be reduced rapidly and extensively by ozone disinfection. Here, the poliovirus gets wiped out 99% in 0.2 to 1 second of exposure to ozone. That's pretty significant. This is some Georgian medical news. Medical ozone has direct antiviral activity which induces long-term remission and in many cases total elimination of viruses from the blood. It modulates the immune system. This is the Ebola virus. A single strain of RNA, the blue is a lipid envelope, and this is called glycoproteins. These are the spikes. It's what the virus uses to literally attach and enter your cell. That's just another model of it. Role of lipids in viral replication. I told you, what I do is scientific. Go back and tell the guys this. Alteration of membrane lipid composition can block viral release and entry. And certain lipids act as fusion and inhibitors, suggesting a role of lipid altering compounds as antiviral agents. Understanding the manifold roles of lipids in viral replication also led to the discovery of lipid active compounds as potential antivirals, but they lack specificity and are unacceptably toxic. So science is already looking at damaging the lipids of viruses, but they only have chemicals, toxic stuff. Well, viruses make new viral envelopes from your cell membranes. They have to enter the cell. So it's grabbing your unsaturated fatty acids, so they are vulnerable based on your unsaturated fatty acid composition. And viruses can't repair themselves. They don't have the ability to do that. Ebola is a lipid envelope virus rich in double bonds, loaded with glycoproteins and potentially vulnerable to ozone. This is the stuff I was studying. Remember, this is a lipid, unsaturated. Ozone comes in, grabs it, and now our cells can repair this. We're made for this. Viruses can't. What's the next part of a virus? Surface glycoprotein thiol groups, SH. Now water is OH, HOH. This is similar, but it's S, sulfur H. From the Journal of General Virology, what they did for CMV, cytomegalovirus, many of you may have had cytomegalovirus. It's not uncommon. They oxidized those SH groups, and I'll show you that, with a molecule, and it inactivated the virus. Then they used a chemical to reduce it back to SH. I'll show it to you in a moment, and it regained infectivity. This is what I was looking for before I went to Sierra Leone. HIV is the same. It engages in a thiol disulfide interchange of, I'll show you, I hope I have it in here. Ozone oxidizes SH groups to disulfides instantly. Our cells can repair this. Bacteria and viruses cannot. The SH groups on a viral particle are like fingers on your hand. If you chop off the SH groups, it's like chopping off the fingers on your hand and you can't open the jar. The virus can't open the jar to your cell. And here it is. Here is a reduced sulfhydryl group, SH. Any reactive oxygen compound is going to come along, grab this hydrogen and make water and create this disulfide bridge. That's inactive. And that's how our body controls the activity of our own enzymes. This would be considered active. This generally would be inactive. Reduction, breaking that up and putting the hydrogen back on, restores it. Now, this really grabbed me. This is from David Sanders, a PhD. The reduction of oxidized sulfhydryl groups on Ebola is a critical step in the entry of the virus into cells. Lay people, am I speaking over your head? A little bit. Okay. What we're doing is we're chopping the fingers. We're oxidizing them. We're burning them. We're putting a match to the finger of the virus. Literally a match. And burning off the finger so it can't get into your cell. HIV-1, AIDS, same thing. Vaccinia, chickenpox virus, depends on reduction of the disulfides. That means the restoration of your fingers on your hand to get into the cell. Ozone oxidizes the sulfhydryl groups instantly. Now, while ozone may disappear very quickly in the blood, those ozonides are left so that the treatment can be prolonged and lasting for weeks or months. In 1918, we had the great Spanish influenza epidemic. This was published in The Lancet. British physician Oliver gave 3 cents worth of intravenous hydrogen peroxide and dropped the mortality rate of influenza pneumonia by 50%. It's untreatable today in today's medical world. You can't treat it. Here's the article. I have a copy of it from 1920. What about bacteria? This group showed that ozone, at just 2 parts per million in 1 second, wiped out 99.9% of bacteria in 1 second, at 2 parts per million. How? Ozone comes along and punches a hole in the bacteria, and it just hemorrhages. And it hemorrhages so fast, it's like getting a, pardon the analogy, a bullet shot through your heart. You don't have time to repair yourself. You're dead. The bacteria doesn't have time to recover. It's an instant kill. Nature does it the same way with ultraviolet energy. Bacteria don't exist in the atmosphere, except rarely. Now compare it to bleach. In Sierra Leone, they were disinfecting everything with bleach. Ebola decontamination was performed with chlorine compounds, and this article says that chlorine decontaminates the viruses at a rate of 1% compared to that to ozone in time. What ozone can do in 1 second, it takes chlorine bleach 2 minutes to do. So why does ozone kill viruses and bacteria and not our own cells? Our cells are aerobic. They're designed for these reactions. It is what our cells hurl at the microbes. So we have defenses, fortresses against this. And our cells make ozone. This is some Science News, December 2002, from the Scripps Institute, that our immune cells make ozone. I'll bet you didn't know that. Science in action. Ozone affects an infection. It floods the bloodstream with oxidants and kills pathogens outright. It modulates the immune system, as you'll see. It stimulates the immune system. It improves the rheologic properties of blood. Rheology for the layman means the flow properties of blood. Red cells are larger than your capillary. They have to bend and fold to get through. That's flexibility. Most people don't know that. Ozone improves this flexibility so you get much better flow through your capillaries. And as I showed you, it stimulates mitochondrial oxygen consumption, more ATP. It dumps oxygen in the cells. The bottom line in all healing is oxygen, period, in my opinion. End of story. You don't have oxygen, your heart's going to die. Your brain's going to die even quicker. My medical life since 1986. I first started with ozone in 1986. That changed my life. After I saw the result with the first patient, I was gone. It was that good with inferior technology. So we're going to look at more of some of the science after I get through the Ebola, because I know most of you will be interested. Ebola is actually a fairly fragile virus. Here's the immune system, and here's Ebola. This is like the United States and the terrorists, but the terrorists know what to do. Now, this is a summary of Ebola from NPR Radio, August 26, 2014. I'll summarize it for you. Ebola is smart. It tiptoes into the system, infects what's called the dendritic cells, which are command cells, and it turns them off. In the meantime, it starts multiplying like crazy by the trillions, and it floods your body, and it just, multiple viruses will infect the same cell. That's not usually heard of. But you get trillions of viral particles, and by the time the immune system finally wakes up, you get an event called a cytokine storm. Now, you just saw the army here. These guys have come out with all their cannons, missiles, nukes, and they start trying to blow apart the invader. And your blood vessels take all this collateral damage, they become permeable, they leak, you hemorrhage, you go into shock. The doctors here would know this is endotoxic shock, among other things. And as I said, Ebola does it by turning off the immune system, and it goes haywire. So the immune system actually does more damage than good at this point. But by this point, the patient's going to be long gone. Now, what about TNF-alpha, which I talked to you, which I mentioned earlier? It is considered a central cytokine in acute virus diseases, including flu, if you get it in your lungs, and Ebola virus. Here's an article recently, Into the Eye of the Cytokine Storm. This is that war that I just showed you. This was popularized in the context of H5N1 influenza virus. That's the Spanish flu virus that killed millions of people in 1918, and we're faced with that today. It's not a matter of if, it's a matter of when. I think you would agree. It's avian flu. And when it makes the jump to people by respiratory transmission, we will have a catastrophe. As presented by Dr. Menendez, this is what ozone does to tumor necrosis factor. Here's tumor necrosis factor alpha induced by a bacterial product. If you give ozone in any way, shape, or form, it almost matches what one of the most powerful steroids would do. Ozone inactivates viruses on contact, reducing the number of pathogens. So in my opinion, it should help most any deadly infection. So realizing the potential of this, and my life's work in oxidation, I decided to go to Africa. And I recruited that guy in the back. Raise your hand, please, Howard. Okay, he's sick. He got sick last night. And he's heard this anyway. He was scared to death. He didn't want to go. He said, "You're out of your mind, Rowan." But listen to what he said. "I'm coming with you. I can't let you get all the credit." So he
Is that a
decided.
parasite?
Is that a parasite?
Yeah.
Yeah, he was a
He's coming
parasite.
with you.
That's right. But he left me for the hard work. He left after 5 days. I stayed for 2 more. Now, this is what happened in Sierra Leone. We had $30,000. People just came out of pocket. Bill Dome and an organization just pummeled us with donations to get the supplies there. This is what it looks like on the street in the midst of an Ebola epidemic. You would never see people on the street here. There were signs everywhere, Ebola, Ebola. This is our doctors at training. This is me attempting to put ozone up by a catheter up his behind, but he wouldn't let me do it. I was demonstrating rectal ozone. This is our team showing how you can give ozone intravenously. It is this simple, the way we did it. This is where we visited and met with President Karoma of Sierra Leone. And this is me on national television after a disaster happened with their Ministry of Health. And this is the result of our work published in the African Journal of Infectious Diseases just a couple months ago. Rapid resolution of hemorrhagic fever in Sierra Leone with ozone therapy. Here are the cases. The 27-year-old physician was the attending physician at the Hastings Ebola Treatment Center where I went to show them how to do it. And this picture was Dr. Khan doing ozone in a training session. He sticks himself with the needle. Within 3 days, he gets fever and abdominal distress. The catastrophe of our trip was the government shut us down, we believe, for financial reasons. And he knew that if he got tested and was positive for Ebola, they would have quarantined him, denied him ozone, and he would have died. 60% risk of dying at that center at this time. So he doesn't get tested. He treats himself with our protocol, and he's totally symptom-free in 2 to 3 days. He didn't get tested, so you could say, well, Rowan, you didn't test him. The next case, Captain Mibrira, a military officer, doctor. He makes international news. He hugged a guy named Salia, who has an American green card. He had Ebola. We offered him Salia ozone. He refused, and he got worse. And he was transferred to this country and died a day and a half later. Mibrira was his friend. He hugged Salia when Salia's first test came back negative. 2 days later, it was positive. And 2 days later, Mibrira was getting sick. That's Mibrira. He received direct intravenous gas of ozone water, some local herbs. He's symptom-free in 2 days and fully recovers. The government bragged that he recovered. It made international news, but they didn't mention ozone, and he was terrified to speak about it. It took me 6 weeks to get a written confirmation from him so that I could publish this. Case 3, Sori Samora, he was a student nurse trained by me at Hastings. He was exposed to Ebola. He only got 2 ozone treatments. After he got some symptoms, they took him away, quarantined him, but he got 2 treatments. And he also got ozone water. He recovered in a couple days in his discharge, and I have a copy of his discharge papers. Here is case 4, a male health aide in the red zone. That means Ebola zone. He informed the facility physician that he was exposed. The facility physician administered DIV ozone instantly. Within a few hours of the gas injection, this was after symptoms came on, he got the ozone, all of the symptoms subsided. He got 2 more rounds of ozonated water as in case 3, but by then he was symptom-free. I got written confirmation from every one of these, and it was like pulling teeth. It took me weeks and weeks to get it out of Sierra Leone. Now I want you to think about this. There was a 60% death rate at that facility. We have 4 cases. The chances of 4 recoveries in any way, shape, or form would have been 2.5%. That's a p-value of 0.025, which is pretty good. However, Ebola has a downhill course like this. Boom! And then you hang around here for hours to a couple days Maybe you'll live, maybe you won't. None of these guys got worse. That is really significant in my opinion. The fifth case should make a movie. I hope somebody picks up on a movie of this. This is a woman who was exposed to their chief doctor got Ebola. He's a surgeon, senior physician in his late 60s. He refused ozone. He wanted ZMAP. He died while it was thawing out. She's scared for his life. She's his consort. They lock her up under military guard, 2 guards in the front of her house. She can't get in or out. They can't get ozone into her. So she scales a razor wire fence at midnight to evade the guards, shreds her skin, makes it to our guys, and gets ozone, and she doesn't get any symptoms. After our visit, mortality fell at Hastings from 60 to 25%, and no one knows why. It's because Kana was spiriting in ozone water and bags of ozone gas to give to people rectally because they wouldn't let him do it any other way. Explanation for the rapid effects. Ozone enhances oxygen delivery. It modulates nitric oxide, which is a big player in Ebola. It modulates cytokines. Remember, I told you TNF-alpha is a big, powerful cannon, which is destroying your system, and that's what Ebola activates. And the main thing is it's safe. So it might be the ideal candidate. Peroxide, hydrogen peroxide is very similar. This is the article from the Lancet. Peroxide can be given intravenously. This was the conclusion in 1920. No, peroxide releases oxygen. You know that. You know, your bottle fills up with oxygen. If you give it intravenously, oxygen bubbles come out. People are scared. What about gas embolism? There's no gas embolism. This is oxygen, and it gets burned up. Direct intravenous ozone. Controversial. The Europeans have been doing intravenous oxygen gas injections for 50 years. In fact, there's a type of cell in your blood called eosinophils. Most of us think of them as allergy producing. They're actually very good at killing pathogens and modulating your immune system. They make an enzyme called 15-LOX1, glycooxygenase 1, and it's a powerful cancer enzyme. And I picked up on an article on this, and I used ozone for some cancer patients, which you'll see in a moment. Here's intravenous oxygen on prostacyclin and thromboxane. The health professionals here will know that the most important vascular lubricator is thromboxane. Prostacyclin. Without it, you're dead. But prostacyclin can get converted to thromboxane, which is extremely powerful inflammatory. So without prostacyclin, it's like draining the oil out of your engine. Your engine will seize. Ozone increases prostacyclin. Intravenous oxygen therapy increases an enzyme called PON1, which is extraordinarily anti-atherogenic for any of you interested in heart disease. A German named Regelsberger published years ago that the rheological properties of the blood, remember, blood flow, blood cell flexibility, is improved when you give small bubbles of intravenous oxygen gas. He said, compared to hyperbaric oxygen therapy, giving intravenous oxygen gas seems to have less toxicity than HBO, because hyperbaric oxygen can be hard on your ears. It's less complicated, less expensive, and probably of higher efficacy. That's Dr. Regelberger's work. You can get his information on the internet. Finally, there was one other oxidation treatment called ultraviolet blood irradiation, which was studied in this country, in hospitals in this country, 60, 70 years ago. Here is an article. 445 cases of acute pyogenic, acute bacterial infection at the Hahnemann Hospital in Philadelphia. This was published in the American Journal of Surgery, April 1947. If the infections were caught early, 100% recovery. If you gave them this form of oxidation, moderately advanced, 98% recovery, and if they were about dead, half of them recovered. All kinds of infections across the board, including osteomyelitis. We happen to have one of the few remaining not machines on the planet, and it works. That's it. Thank you for being the model, Terry. So now we'll move on to some other things. Ozone therapy is seen by Dr. Menendez, Dr. Bacci, and me. This is a book called Ozone, a New Medical Drug by Vilio Bacci. It's available on Amazon. Here are the ways that medical ozone can be administered. I've done every one of these except the ones in green, intraperitoneal and intrapleural. That means in the lung space. Not in the lungs, in the lung space. Ozone can be given most any way to the body, including teeth. Bill Dohm will tell you that, with one exception. You can't breathe it. It's hard on the lungs. But you can give it any other way. And I've done all of these, including giving it into the artery. When you get ozone, this is the antioxidant status of blood. Ozone exercises you by reducing your antioxidant status, and then the blood recovers very quickly, like in about 20 minutes. We're made for this. Bacteria and viruses are not. Ozone does have a limit. This is a concentration of 70 micrograms per cc. If you give more of a concentration, you can break apart red cells, and we don't want to do that, so we limit our concentration to 70. Here's 2,3-DGP, that's the magic molecule. When that increases, your red cells can release oxygen, and you get oxygen in your tissues. Without it, you don't get it. Here, with 2,3-DGP, you'll release half of your oxygen at this pressure, 22. To release that much oxygen without 2,3-DGP, the pressure has to go all the way down to near zero. And gases and liquids move by pressure. So if your pressure is near zero, it ain't going to move. Ozone, for the scientists here, ozone reacts with fatty acids on the cell surface. This is an oxidized fatty acid. And then glutathione, most of you have heard of glutathione, steps in with a molecule called NAD and NADPH. That's a vitamin B3 molecule to complete and repair this ding that ozone does. It's just a ding. Now, for the scientists here, there's NAD all over the place. Nicotine adenine dinucleotide. It is involved in every step in energy production. Well, it turns out that the ratio of oxidized NAD to reduced NAD appears to be one of the most crucial steps in cellular biochemistry. And you should have this ratio to be 700-to-1. Ozone jumpstart this. It jumpstarts it by oxidizing NADH back to NAD so that your cells can get going again. The mechanism can get going. Ozone makes nitric oxide. It's a vasodilator. Ozone modulates cytokines. That's what your immune system cells use to talk to each other to fight infection. My friend Frank Schallenberger postulates that ozone modulates the immune system. So in AIDS, if you have a lousy cellular immune system, which is down here, and you're a walking bag of antibodies which aren't doing any good, it brings you back into balance like this. That's called modulation. Platelet effects. Ozone stops platelets from aggregating. I'm correct that. It doesn't stop them. It modulates it so that your platelets aren't aggregating and making clots all over your body. It induces SOD, superoxide dismutase, catalase, and glutathione peroxidase. This is the muscles that it's building during oxidation. Bacci says that it creates super gifted red blood cells. Red blood cells is what carries your oxygen to your cells. And if it makes super gifted cells, you're going to be flooding your body with oxygen and you can make energy and repair. These are German indications, all kinds of stuff. Arterial, geriatric, adjunctive therapy in cancer, rheumatism, dental ozone, lumbar discs, which we're going to show you. This is Cuba. In Cuba, they treated more than 2 million people. 80% of the people get good results, and there are virtually no side effects, no toxicity. These are all the things that they studied, and all these can occur due to pathological oxidative stress. There's always oxidative stress in the body. We're talking about pathological oxidative stress. And here are the animal models that I showed you earlier. I mentioned to you carbon tetrachloride, a lethal liver poison. If you drink carbon tet, you'll be fine today. And in 12 to 24 hours, you'll be dying of liver failure. Ozone preconditioning stops that. renal failure. You can induce renal failure in an animal, and if you give them ozone therapy, you can stop it from progressing. Peritonitis. For the guys in this hospital, this is really valuable. This is lethal peritonitis in animals. This is the control. No treatment. These are antibiotics. This is when you throw ozone into the mix with an antibiotic. 93% survival, compared to the best antibiotics that are out there for this. IgE, asthma. IgE is a molecule in your blood which can stimulate unwanted allergic effects, like bronchospasm and like eczema. When you give ozone, IgE falls, that's the yellow, and it doesn't matter how you give it, even if you give it rectally, it works. This is a slide showing what your lung capacity is before and after ozone therapy. So this is rectal insufflation, this is blood treatment. In this particular case, they're looking at what's called FEV1, the amount of air you can expire in 1 second. It goes up significantly when you give ozone therapy across the board with asthma. Acne rosacea. Before, after. Before, after.
How's it applied there?
15 cc's 3 times a week. Probably by IM. This is my case. Not me, my patient. June 9th, 2015. I wish he was here. He's local. He was bitten by a tick. A couple days later, he gets this rip-roaring cellulitis. I treat him with 10-pass ozone, Howard, and this is what he looks like 2 days later. This is one of my rare cases where I actually insisted he walk out the door with an antibiotic because I didn't want to be responsible if he died of sepsis. He didn't fill it, and he sent me this picture a couple days later. This is a gentleman that I treated in conjunction with Dr. Sen. Where are you, Dr. Sen? This fellow came to me with severe dermatomyositis. He is on Imuran, methotrexate, 80 milligrams of prednisone and Plaquenil. And this is what he looks like. He's a laborer, he's a field hand, and he looked like death warmed over. I said, "What happened to you?" And he explained to me what was going on. I did some kinesiology muscle testing. I found he probably had infection in his teeth. He was local to this area, so I sent him over to Silvano. He started working on his teeth. He continued to get more teeth done by a Mexican dentist. I gave him DIV ozone and major autohemotherapy. This is what he looked like a couple months ago off of every one of his drugs and living normally. Rheumatoid arthritis, Senora Maria, who is on my YouTube channel. Both of these people are. She was barely able to function. She's about 41 years old with a family, rapidly advancing rheumatoid arthritis on methotrexate and a very toxic drug called Enbrel. She got oxidation therapies and supplements. She's now off of all of her drugs and living a normal life. She's got extraordinarily low-grade activity in her hands, which we treat from time to time. This is a Cuban slide. This is scleroderma before, scleroderma after treatment. This is one of our cases. I want you to see this. Is it going to play? Oh, come on. You played earlier. Nope. Darn it. Cancel. I don't. This is a woman, she's on my YouTube channel now. She came in with chronic fatigue. She flew in from Houston, Texas, and she's a nursing student. And I'm sorry this didn't come out. It was playing earlier on this machine. And in 2 days, Pamela, what happened?
She had her brain fog completely lift in the middle of the treatment. And she had brain fog for how long?
Well, no, this is the one who just had total fatigue. And when she came back 2 days later, she came back and said, I climbed the cliffs at on the beach,
Yeah, yeah.
okay, at Bodega Bay. She couldn't believe what happened to her.
Everywhere you see-
Painful chikungunya virus. This is now endemic in the country. It's going to be a catastrophe in the southeast. It's a mosquito-borne virus. It can cause encephalitis. It is in this country. My latest case, she came to us a couple months ago. We treated her with ozone for 2 weeks. This is an email from her. I'm feeling good still. I haven't had any joint pain. She's having pain in her muscles from disuse. She couldn't use her muscles for a year. She works at a medical school in the Caribbean. She's lost 15 pounds, which is good because she gained all that weight due to inactivity. And she said, "You made a big difference in my life. The treatment really worked." 2 weeks, a year of misery. Cubans, glaucoma, visual acuity improved in 85% of cases. The visual field improved in 100%. Intraocular pressure improved in 67%. Macular degeneration from bocce. This is a normal retina. This is holes in the retina due to macular degeneration. All of you know what macular degeneration is. Bocce showed that the visual acuity improves in ozone-treated patients, and the improvement holds for up to 18 months, while if you're not treated, your visual acuity gets worse. This is SOD, superoxide dismutase. So this is showing you, they measured SOD. This is a key enzyme in the body, SOD. And this guy here, MDA, is methylmalonaldehyde. It's a toxic compound indicator of oxidative stress, malondialdehyde. So when you give ozone, this oxidant product initially goes up and then goes down, while SOD goes way up, which is something you really want. Well, guess what? SOD, this was published. Journal of Biological Chemistry, 2003. Extracellular superoxide dismutase is a major antioxidant in human fibroblasts and slows telomere shortening. Let me translate this for you. The telomere is the end cap on your DNA. It's like a shoelace cap. It protects it. As each cell divides, it shortens. And if it gets too short, your cell gets old, senescent, and dies. Telomerase regenerates that. SOD apparently helps telomerase, and I've just shown you that ozone stimulates SOD in every model ever done. I think ozone is a fountain of youth, and it's one of the reasons why I do it regularly. Tumors. Tumors thrive in hypoxic environments. These guys postulate that a prolonged therapy of ozonated autohemotherapy might correct tumor hypoxia. Here's another article for tumors. Despite being administered over a very short period, ozone therapy improved tumor oxygenation. That's good. The tumors will behave less aggressively. Here's another article. Same thing. So this is a case, my case. This is Swami. He's dying, stage 4 cancer. He's got mets in his liver this big, and mets in his lung as well. He was on death's door when he came to us. This is what he looked like. Now, we first saw him in January. I was first called about him in December 2009. It's now 2015. Take a look at his alkaline phosphatase, 582. Within a couple weeks, it's now 48. The liver lesions during that period of time, this is the size of the liver lesions. This is the dome lesion. This is the hilar region. They dropped by 80% in 3 months. There's the alkaline phosphatase. This is what he looked like 5 months later. Now 4.5 years later, here he is. And he's still alive and well today with no trace of cancer. I will admit, we had to send him to a surgeon. I'm an integrative doctor. His liver tumors went away. At 1.5 years, they were gone. But he still had a tumor in his cecum that was bleeding. So we sent him to a surgeon. The surgeon was actually very open-minded. He actually talked to me, was impressed, did the surgery, called me up, said, I can't believe how easy the surgery was. It was a piece of cake. Scooped it out. The man's been tumor-free ever since, to the best of our knowledge. Second, Swami melanoma. That Swami sent this Swami to me. Here's stage 4 melanoma on his gum. We do the same thing on him, triple oxidation, various forms of ozone. I send him back to an Oregon naturopath willing to do the program, and this is what he looked like several months later. Now, in truth, this guy thought he beat it, so he didn't continue with the program, and then earlier this year he came back to me more than 5 years afterwards, so he made the record books. You know, modern medicine says 5 years. He went 5 years symptom-free, but he came back with stage 4 cancer, and we couldn't help him. This is an email from one of my trainees. I train doctors in this from all over the world. This is dated November 24th. By the way, Robert, I had an amazing case. A woman came to me with stage 4 breast cancer, mets to the liver and bone on a PET scan. Her oncologist gave her a 10% survival, even with chemo. I treated her aggressively with multiple pass ozone, MAH means ozone, twice a week for 2 months. We just did a repeat PET scan, and she's cancer-free. The oncologist says he's never seen this before. This is more enzymes showing you that the antioxidant enzymes go up, glutathione peroxidase when you treat them. This is now we're into vascular disease, arteriosclerosis and ozone therapy. They were giving ozone by different methods. It didn't matter which method of ozone they gave, all of the methods worked, but hyperbaric oxygen didn't work. This is an improvement in the intermittent claudication double. What this says is, if you have vascular disease and your legs get stiff and you can only walk this far before your legs clot, that's called, cramp. That's called claudication. With ozone therapy alone, they can walk double the distance. This is giving ozone intra-arterially as well. I've actually done that, but you don't have to do that very often. Arteriosclerosis obliterans. That's exactly what it says. It obliterates your legs, and it works. Here's ulcers treated with this therapy, healing up, just giving them ozone. Think about the billions and billions that are wasted in hospitals like this. There will be cases here that we could heal up in a matter of weeks instead of months. From here to here, from here to here. These people would have received bag ozone. You can put ozone in a bag around the leg and the wound. You could put ozone over the wound here. And they would have also received ozone by the methods that we use. Here's a heel ulcer. People get amputations for this. It's not necessary. Chronic limb ischemia with ulcerations. What do the medical doctors do? The medical doctors cut or blockade your lumbar sympathetic nerves with drugs, or they cut them surgically. They were only moderately effective in reducing the pain, but had no effect on the ulcers. After the ozone therapy was done for several months, they got healing of these things. This oxygen ozone protects rat hearts from ischemia reperfusion injury. The doctors will understand that. Speaking of pre-treatment, ever since I got into ozone in Alaska, I started giving everybody who needed hospitalization ozone. If I knew they were going into the hospital for surgery, I just did it. Let me read this to you. I have not had one patient develop a wound dehiscence. That means the wound coming apart after surgery, or an infection, or a post-surgical complication. It gets better than that. One of my female patients, the wife of a state senator who hated me, she was now divorced. She was my patient. She needed a total hip replacement. We treated her before she went into surgery. The next day, she's walking around her room. She didn't use anything for pain. She's ready to leave the hospital. The orthopedic surgeon walks in and says, "How did this happen?" She says, "I saw Dr. Rowan before coming to you." He walked out of he just turned around and walked out of the room.
Through the blood.
Yeah, that was blood. I'll also tell you that in Alaska, one of my patients was denied service in an emergency room for a bleeding intestinal cancer, and she died. And they refused treatment to her because she was my patient, and I sent her to the hospital because of this. This is how ugly medicine is. I remember her daughter's name. This is what happens to platelets. Platelet aggregation goes down with ozone therapy. One of the problems in today's world is we're so inflamed that our platelets are aggregating, throwing clots around. I already showed you this slide. This is prostacyclin, the magic vascular lubricator. We want prostacyclin. It's a vasodilator. It has anti-inflammatory properties and anti-cancer properties and makes the blood cells stay apart. You don't want them clumping together. It's undisputed that it does these things, and it comes from the omega-6 fatty acid series, not the omega-3. You're fooling yourself with fish oil. Ischemic cardiomyopathy. All patients improve their general condition. This is what happens with lipids. Cholesterol comes down a little bit, LDL comes down a little bit, HDL does fine, and triglycerides it might go up a little bit. That was Cuban. These results, this is during hypoxic injury to the brain, suggesting that if you give ozone therapy to animals and you induce hypoxia, meaning no oxygen going to their brain, you can spare them tissue destruction with ozone. This is important for you. This shows that ozone improves blood viscosity, meaning makes it less thick, improves blood flow parameters, but hyperbaric oxygen, HVO therapy, didn't do it. It was ozone that did it. We're getting to the end. I got a couple of nice videos to show you. Pulmonary tuberculosis. I guarantee you'll see it here. And you're getting resistant. Ozone reduces resistance. Here's 2 scientific articles. I told you I don't pull anything out of a hat. Everything I do is science, applied science. Morphological changes in the placenta after ozone therapy. Yes, you can do this to pregnant women and women who might deliver early. It improves, this article shows that it improves their placenta and it spares their pregnancy. You can give it to children. This is necrotizing enterocolitis in neonatal rats. That's a horrific condition that affects humans, where it wipes out your gut due to infection. And they gave ozone to the animals and it saved them. I'm not going to go into a hospital and do this. There's too much liability. Hyperbaric in experimental acute necrotizing pancreatitis, the effect of hyperbaric oxygen therapy. Both ozone and hyperbaric reduce the severity and mortality. A greater benefit came from ozone therapy. Pancreatitis is lethal. It's a calamity if you get it. The doctor would agree, yes? Ozone therapy is a good treatment for it. Nose correction operations. Remember my comments about my own surgery destined patients. This is an article just confirming that if you prepare them, you do well. Now, this is new. I figured this would get a laugh, but it's real. This is ozone therapy in Peyronie's disease. Peyronie's disease is a fibrous plaque in the penis. So when the penis gets erect, it doesn't go like this. It goes like this. Not a lot of fun for the guy or the woman. This is Sylvia injecting a plaque. Here's a signed statement of the guy. And this is the results they would get with Peyronie's disease. 27% very good, 40% good. I would imagine any guy in this category would have a big smile on his face in any of these 3. Only 10% weren't happy with it. Dupuytren's contracture is basically the same thing, only it's in the hand here instead of the penis, and you can treat it. And we've had some good results, not across the board, because by the time I see it, it's really advanced. One of my colleagues told me after her training with us, she went back to Australia and did it, and the guy was fixed. Retinitis pigmentosa. It helps retinitis pigmentosa, a genetic condition. It helps it dramatically, but you have to keep it up. These are what happens to lipids when you do it. The lipids, the cholesterol and triglycerides fall. This shows you, again, the increase in 2,3-DGP. We're going to run through this quickly. Sudden deafness. The Cubans did a study on sudden deafness and a variety of other things, and they found that ozone therapy works, 80% recovery of sudden deafness, but you've got to get to them right away. It must be treated as soon as possible. No side effects. Diabetes. Any of you have diabetes? No, I'm glad. The Cubans induced diabetes with a compound called streptozocin, which wipes out the islet cells of the pancreas. They then gave the animals ozone rectally, and it modulated their glucose metabolism. The only thing that could have done that was a regeneration of the islet cells. 2 articles on this. Ozone treatment improved glycemic control and prevented oxidative stress. Menendez told me that it appeared that ozone was regenerating the cells. Senile dementia. Cubans are showing improvement in senile dementia. It increases superoxide dismutase and catalase. Daily life activities are improved in multi-infarct dementia, mixed dementia, Alzheimer's dementia, all kinds of dementia. Ozone is helping them. Parkinson's disease, it improves the quality of their life. Lumbar disc disease, 80% improvement. This is published data. We're going to get to my, hopefully I'm going to be able to show you this, but maybe not. This is shooting a knee with ozone. This is important because in osteoarthritis, how many of you here have osteoarthritis? Several of you. Take a look at this. Superoxide, MDA, that's a toxic compound, and a healthy control is 3.35. After you give ozone, it goes back to normal. SOD catalase. What this is showing is there is inflammation in the joint. It's an inflammatory condition in the joint that's destroying your cartilage. And these enzymes are measurable. And when you give ozone therapy inside the joint, you put the gas in the joint, you restore the enzyme function to normal and reduce the inflammation. This was presented in this country a couple weeks ago at the American Academy of Rheumatology, a Brazilian study on the same thing. I'm just going to tell you in layman's terms. You get about an 80% effectiveness in knee arthritis. This is now presented in the United States. Why? Here's your joint. The NSAID drugs inhibit COX-2. Ozone, I already showed you, does it by itself without any problem. Ozone helps superoxide dismutase, which is crucial. It modulates the inflammatory cytokines, and it restores, it gets rid of the inflammation in your joint, and it kills microorganisms that might be there. Here are some x-rays. 76-year-old male. This is what ozone does. Here's another one, before, and now you can see joint space. Any little bit of joint space is a dramatic improvement. Oh, good. Yay, it's working. I want you to see this one. Let's hope it speaks.
Okay, this is May 7, 2013. We're here with Milka, who's from Eastern Europe originally, and she was a former nurse. She's here today because she's got severe degeneration in her knees.
Don't touch.
She also has probably having a very significant problem with candida. She's had 5 or 6 different antibiotics this year alone. She's been treated for H. pylori. She has fatigue, muscle stiffness, muscle soreness, cramping, fatigue, symptoms of hypothyroidism, and her knees are in really bad shape from arthritis. And that's what I
Look
want
at her
to show you
face.
first
Yeah.
is the knees. So there's a shot of one of her knees, but I'm going to ask her if she would please get up out of the chair and walk to the door. Remember, we haven't done anything with her yet. Look how difficult it is for her to get up. Now walk to the door,
It's actually
please.
easier because 2 minutes ago I got up, so it was,
Okay,
and, yeah.
please walk to the door.
Muscles a little bit stiff.
She's actually walking easier right now because she was walking 2 minutes ago. Look how she swaggers.
Okay, and come back to me. Difficult. Okay.
Yeah.
The treatment takes 30 seconds.
Say that again?
To get up, down.
Yes, please get up. Okay, now what?
Gee.
What? What'd you say?
Gee. Yeah.
Yeah? Yeah, what?
Yeah.
Yeah?
can with no stiffness.
Okay, walk to the door.
Hey, look at this. Hey, look at this. I need that. This one is still a painful injection.
I know you mean it, okay.
My right one, look at this.
Walk to the door and back.
See, I can walk totally straight, no problem.
Look at that.
Yeah, I can even little swing.
Doesn't that make your day? That warms my heart.
Yes.
She ran out to show off to her husband, who was getting an IV in the next room, who couldn't believe it. I only needed to see her one more time. That improvement held at 80%. She came back 2 weeks later. I did her one more time, and I haven't had to see her since.
Did you go one knee or both knees?
Both.
Did you?
And unfortunately,
Can you talk about disc herniation that you just went back?
this is coming up. Yeah, we'll show you. This could be a disc. Watch this. This could bring tears to your eyes. This is on YouTube.
What would we put in to find it?
My channel. I'll show you at the end. We're not going to get to the end of this, it'll be too long, but her mother's out in the parking lot dancing around like this, doing a jig. About 5 minutes after I shot up her back.
And agony that I've been in is dealing with various doctors, chiropractic, massage, spinal doctors, and the final result was to get a cortisone shot. I've worked every day since this, and it's very emotional for me because I haven't gone a day since the accident without being in pain. I can't do the dishes, I can't cook a meal, I haven't grocery shopped in 4 months. I spend more time laying down, trying to give my back an opportunity to rest from the fatigue, whether it's 15 minutes or an hour. I drive for a living.
She's crying. I love to see that.
I drive for a living, and there's times where I have an appointment an hour away from the house, and when I'm trying to get home, I'm 30 minutes from the house, and I almost stop to get a hotel room because I'm so fatigued I cannot make it home without being in pain. And I'm just grateful that there's other options out there for me, and I'm looking for some clear results here. Thank you.
Well, I'm looking for them too, thank you. I have your permission to video you and post you, is that correct?
Absolutely.
Thank you very much. Now, this is for the viewer. I'm not always able to get a before photo shoot, so I'm really happy right now that we've got you before. I'd like to show the viewer the range of motion of your neck.
Pay attention to the range of motion.
Okay? All right, turn your head to the right, please. That's not bad. Now turn your head to the left, please.
You can all see that, right?
Let's say there's a significant problem.
Watch up and down.
Keeping your head in a vertical position, touch your ear to your shoulder. Like that. And the other way. Okay? And now, I'm going to ask you to bend your head forward as far as you can.
That's very
Back
limited.
as far as you can.
Very limited.
That's very limited, wouldn't you say? All right. Thank you very much. You were telling me about what your doctor wants you to take?
My primary doctor has asked me to take muscle relaxers, pain pills, and then the latest was depression.
Something for depression?
Yeah.
Yeah.
And so, yeah, and it's been a couple weeks since they've given me that medication, and their bottles have been unopened.
All these bottles are unopened.
Absolutely.
This is really valuable for the viewer. And I can't tell you how many patients I've seen, especially women, are given drugs for depression.
Yeah.
Which is a horror story for me because you're not depressed. Number one, you're in pain. And number two, these drugs can have catastrophic effects.
Correct. I was feeling hopeless, not depressed.
3 weeks later.
You're looking at your results.
I am.
You're not going to use that language, but you got a big smile on your
I
face.
do.
Wednesday, May 8th, we're about 3 weeks after we did your treatment, right?
Yes,
Are you happy?
I'm so happy. I felt great. I'm working out again. I have light in my eyes, and I have rotation in my neck.
Let's see that rotation. Let's see your neck. Go down forward. Go
Look
down.
at her chin, touch her chest. Look at her head go back.
Now, let's see it turn from side to side. And the other side.
Was
Okay.
this
I
IV
see you
or-
touch your ear to your
or-
shoulder.
No, this was local injection to her spine.
Okay.
Disc problems.
Making a video.
Watch, look at the objective range of motion improvement. I measured it.
For the viewer, we're going to show that when you walked in the door, your flexion extension was
80.
40, a total of 80. When I got done with your first treatment 3 weeks ago,
From 80 to 110 after the first treatment. That's a 30-degree improvement at the end of the first treatment.
now you're
Now
6%.
135, 55 degrees improvement. She went up 25 more in the ensuing 3 weeks.
That's an extra 55.
Wait till you see the
degrees of
rotation.
extension before I did anything else, right?
Yeah.
Okay. Your rotation of your neck was 70 and 40, 70 to the right, 40. Not much of a change here, you went to 60. But now, look at your rotation.
90 and 90 through 70 and 40. 70 and 40, 110 to 180 degrees.
Yeah, very happy.
Okay.
Disc herniation, biomarkers. Somebody asked me about discs. This is the science from Cuba that you reduce the inflammation due to the disc. Here's what happens. Here's a ruptured disc. This is when you do local ozone therapy in the area. It reduces the rupture. The layman can see this, I'm sure. You can see the rupture here compared to a much smaller rupture there. It helps it heal. Same thing on this one. Ozone therapy in lumbar sciatic pain. What has been found in the research is originally we thought that you had to go right down to the disc. You don't. You actually can give ozone anywhere in the area. It's that effective and that forgiving. You can even give it IM in the muscle, and it works most of the time, not all the time. This is ozone in herpes zoster. Ozone by rectal application. My observation of ozone and ultraviolet for herpes zoster have been nothing short of phenomenal over 30 years. I've not had one case go on to get post-herpetic neuralgia, which is a crippling, painful condition after shingles. The wonder of the Cuban research, we're about done now. They did it with rectal administration, which is very easy to do. Blood administration is far more effective and fast. You can get a rectal machine. I teach how to do that. The Cubans did studies. They studied bioassays, histopathology, looking at tissue. They tried their best to induce injury with ozone. They tried and tried and tried. They looked at the heart, kidney, spleen, testes, ovary, brain, rectum after they gave ozone repeatedly in the rectum. All toxicological studies for ozone. No evidence of toxicity was ever observed. The benefits, the Cubans also did control studies using oxygen, not ozone. And it was ozone that did the effects, not the treatment with oxygen. Although Robbins and Regelsberger and others showed that DIV, intravenous oxygen gas, has effects. This is a book I co-authored called The PEO Solution. You won't eat fish oil after you. How many of you take fish oil? Get the book. We have it in the office. You won't take fish oil again. Now, this is my last question for you all, and then we'll have questions for me. Can you think of a reason why ozone is not mainstream in this hospital and all over the country?
Yeah.
One word.
FDA.
What?
Profit.
Close.
Big pharma.
Close.
FDA double-blind study.
Patent. Profit.
Exactly.
Profit.
Patent means profit. If this were to get out, it would essentially be the destruction of the current disease maintenance state as we know it. There is no profit in developing it. In the case of DIV, direct intravenous gas, and rectal ozone, it is virtually costless. Please always follow the money trail for understanding what is going on in this country. Ozone offers more good for more medical and health matters than anything I've ever seen in my entire career combined, except proper nutrition, detox, and stress reduction. Thank you for the honor of your presence. That's my YouTube channel. You all are welcome to visit it. And I'm open for Q&A, and I really appreciate your time.
You mentioned a lot about,
Could I ask you to wait a second? Let's go back to your, we want to get the questions on the tape. Who was that?
so a lot of your results you mentioned on, anyway, preconditioning. So if you could say a little about treating after symptoms or preconditioning or what that means.
Sure. The question was, the Cubans were showing that you could precondition with ozone and mitigate problems with toxins. Well, I don't have that luxury generally. I see people after the fact. I see people when they have Lyme disease, after they have multiple chemical sensitivity, after they're miserable, after their brains aren't working, or they have brain fog. And it shines. Howard Robbins is in training with me from New York, and he saw us do a lot of ozone on a patient yesterday with Lyme disease. Chronic Lyme disease, tests proven. Classic symptoms with joint swelling and pain. And on the chair, in the chair, while she's getting the treatment, 9 months of brain fog cleared up while she's being treated. Yes, Doc? Silvano, you saw it too, didn't you?
Oh, yeah, it was like amazing.
So yes, it's not a matter of preconditioning. I take it for preconditioning because I travel and I do other things and people walk into the office and they could be sick, so I just take it. And I do it on a regular basis. And I also think it'll probably prevent cancer, slow down the aging process, keep my immune system up. And my family members tell me they think I've aged much more graciously than other family members. I don't know, maybe it's my diet. I'm an organic raw food vegetarian, and I got to throw that in the mix too. But we're treating conditions in the office. We treat disease states. Next question. Tony.
Robert, you treated me with preconditioning when I had my chemotherapy. And I had, what was it, carboplatin?
Yes.
And my oncologist couldn't believe how, because I'd come bouncing in there, singing and dancing and all that kind of stuff, and everybody else was dying. So it does work. Every week I had ozone therapy during the whole treatment.
Tony, may I share a little bit more about you?
Sure, go ahead.
Tony is a dentist in this community. She's been dealing with cancer since 1990. She had her female organs removed around that time, and then her CA-125 started coming up several years ago. And she panicked, as anybody might, and she went and got low-dose chemotherapy in Nevada. Our ozone therapy helped protect her, but she came back with chemo brain. I mean, you can't do it all. And then we gave her ozone again, and we did some other things with her. And she's on a program now where all of her tumor markers have returned to normal, below normal, in fact. And so far, so good. You know, this is a lifelong thing. Thank you very much, Connie. She's on YouTube, yes.
So it sounds like a prophylactic regimen of ozone therapy would be a good thing for just about everybody.
I think it is. I recommend people to have a machine at home and take it right. Listen, I don't know how many of you listen to people talking about economic calamities and wipeouts in the near future. I think that an ozone machine at home is one of the best things that you can have for this.
So what would stand in the way of people being able to do that?
Nothing. You just have to get one. Come to our office and we can show you how to use it. This fine lady right here, Kamala, will help show you how to do it.
There's no such thing as prophylactic ozone. Everybody in here is harboring trillions of organisms. June of 2012, Scientific American magazine cover story. Bacteria outnumber healthy cells in your body 10 to 1. Who's in control? You harbor about 5 pounds of your body weight as these organisms that weigh a million of them don't even weigh an eyelash yet, so think about what you're harboring. Everybody in here needs therapy to prevent illness. Otherwise, wait until it happens. That makes us money too.
I'll share this with you as well. My blood pressure, thank you for coming, guys. I know you have a long trip back. Thank you very much. It was an honor that you came.
Our pleasure, thank you.
My blood pressure, anybody want to take a guess? Somebody take a guess, a doctor take a guess. In Florida, it was 77 over 47. On an average day right now, it's about 90 over 60. I have the blood pressure of a young adolescent. And I'm not hypoadrenal. I like the John Muir Trail.
Yeah, hi, thank you for coming. We're your
Thank you
biggest
for being
fans and have been following you for 3 or 4 years and actually sell ozone generators on eBay and dabble in ozonated olive oils. I was wondering if you could just touch on the benefits of ozonated water and what is an ozonated oil, for those that don't know.
Ozonated oil you can get online. It could be olive oil, it could be flax oil. They actually sell all kinds of oils. The more unsaturated those oils are, the more ozone they carry. Ozone coconut oil is not so full of ozone, and it's probably good for skin and improving, for women, almost like a beauty thing. Ozone olive oil can be used for funguses, skin infections. I just heard recently that somebody used it for a neuropathy in their leg and the neuropathy went away. You can swallow it. You might think you can't because it's oxidized, but it's very safe. You can get rid of H. pylori with it. You can squish it around in your gums. Bill Dome is a specialist in this field, and he uses a lot of ozone water in your mouth, on your teeth. They inject ozone in around root canals and gums. They can take care of osteonecrosis with this. So ozone water and ozone oil do have a place. You can ozonate water and pour it on wounds. You can put it in your eyes. My friend Ed Conrad, who's a world-renowned eye doctor, he ozonates water and puts it in eyes for various conditions.
My friend's cured ear mites in the pets and mange. The dog doesn't like the liquid, but it goes away.
It doesn't smell good. Agreed. You can't breathe it, but you can take it any other way. It's essentially not toxic. Yes.
I wasn't able to take that.
Let me get you the microphone.
It's not on.
No, this is just for the recording, it's not for...
This is going to be posted. And by the way, I hope I made you think. That's what I came here for, and I hope I planted some seeds in this hospital, because there's a couple doctors here who are on the staff. This was science I presented. All right, this wasn't quackeriola. Would you share this with me and I'll pass it on? Yeah. This was hard science. And I'm speaking from my heart right now, very humbly. I sweated blood over getting that article on Ebola. The government shut us down deliberately. It was very ugly. I can tell you about it some other time. I had to wait months and months to get the verification I needed to even submit that article. And it found a nice home, the African Journal of Infectious Diseases, right where Ebola was. And I wish the world would look at that, because people are still dying of Ebola. Yes?
Well, I just want to appreciate you for taking as many risks as you have to bring forward all of this medicine, making it possible in our community. But I had a question about the water. I wasn't able to take the hydrogen peroxide mixed with the water. It just racked my guts. And
I can answer that.
It's a couple grand to buy a good ozonator to create water. And I don't know where I could go to taste the water to see, can I actually handle that, so that I don't end up having to buy a really expensive ozonator and then not be able to handle the water.
I've been doing oxidation therapy since 1986. I can help you get an ozone machine. There's
Just to test the water. Where do you live?
Ma'am, my name is Jennifer. I'm the office manager for Dr. Rowan. If you grab one of these business cards on the way out and give me a call tomorrow, I'll be happy to make you some ozone water at the office. So you can try.
And Dr. Sen will do the same thing. He's here in Sebastopol, he'll do the same thing. Now, let me tell you about hydrogen peroxide in water. It's dirt cheap to do, but hydrogen peroxide has much more risk than ozone when you drink it. I've never recommended it, even though many people swear by it and it helps them. Why? because H-O-O-H in your stomach, that can separate into hydroxyl radicals and be extremely hard on. Now you're dealing with pathological oxidation stress. Hydrogen peroxide can do that in your stomach.
This gentleman was nice enough to give up the microphone for two other ladies. Can we get back to him?
Oh, please.
Actually, I had a question along the same lines with the ozone water. How is it that it doesn't affect our microbiome in a negative manner, whereas as it does all this, you know, it can kill the Ebola virus and whatnot, but it doesn't affect our
You know,
own
that's
beneficial bacteria?
an excellent question, and I thank you for it. Ozone is given rectally, so it is in your gastrointestinal tract, but that ozone gas doesn't make it all the way up. I know people who do colon hydrotherapy, and we're hopefully going to start doing that soon with ozonated water, reaching the entire intestinal tract. Then the good, nice germs generally are aerobic. So they can handle this better, number one. Number two, you're modulating your immune system. And the gut microbes are like a au pair with you when you're healthy. You're helping them, they're helping you. So we can help you maintain, I believe, a healthy microbiome with this by helping purge the bad guys and helping your body assist the good guys so that it works as an au pair. Does that make sense?
Mm-hmm.
And the good guys are generally going to be a bit more resistant. And you're also not totally wiping out your gut. You can't. The idea is to help your immune system make balance with the good guys.
I've been missing the middle of the room. Will you
Rob, are you
share?
using any probiotics?
Yes, we use probiotics. Howard turned me on to one that we like. It's called Xana Juice. It comes in a gallon jug. It's liquid, and it smells like sauerkraut. He swears by it. A lot of our patients like it. It's not the only one. There's others. I'm getting another one in the office, and we're going to check out soon.
So what's the story with fish oil, and what's the problem?
It's a long story. I would love for you to get the book. I'm not here to sell you books. I almost thought about bringing it, and I'm sorry we didn't now. But fish oil is made out of like salmon or cod that live at 34 degrees Fahrenheit temperature in low oxygen environment and no light. What happens to these oils when they're exposed to heat and air? They oxidize instantly. These oils are oxidizing and going rancid as you swallow them. So you might think you're getting a benefit from alleged anti-inflammatory properties, and yes, when you take them in pharmacologic doses, they are anti-inflammatory in pharmacologic doses, and you're also giving your mitochondria a pharmacologic dose of rancid oil which destroys its membrane.
And so instead?
I recommend plant-based oils. They're much more resistant, and that's what we're made to be eating. Now, I didn't tell you not to eat fish. I told you that the marine oils are highly unsaturated and highly vulnerable, and they start oxidizing at a rate of 200 times that of olive oil, which is a monounsaturated. Not good.
The ozone. And I do know people that actually have ozone air filter types of things. Why isn't it good to, why is that the only avenue that you can't do it?
That's an excellent question. So she asked, what about breathing it in ozone air purifiers? I have no problem with ozone air purifiers. Some state regulatory agencies do. I don't. However, you can overdo it. If the ozone air purifier is set right, the air smells sweet like after a thunderstorm. I showed you the lightning bolt. It makes ozone in the air, and the air smells sweet. If it goes beyond sweet to pungent, now you're overdoing it. There's the problem. Now, there is a way to breathe ozone. There is a way. You can bubble ozone through oil. You can take 2 parts pine oil, 1 part eucalyptus oil, and bubble ozone through it at a very low rate, and it makes a mist, and you can breathe it, and it smells wonderful, and it's very safe because all the toxic properties of ozone to the lungs have been taken up by the oil. Otherwise, don't breathe ozone when it's pungent. Now, that said, Breathing a little bit of pungent ozone once in a while is a nothing. Once in a while. I use the machines. Sometimes gas comes out and I breathe it. I don't care. It doesn't bother me a bit. And I can hike up to the top of Mount Whitney, and I've been using this stuff for 30 years. So I don't want you to think that it's going to burn a hole in your lung. It's not going to do that. We just don't want you breathing pungent ozone over a prolonged period of time. Does that make sense?
Well, I'll just quickly, because this may just be for me, but you talked about how the ozone will oxidize, damage the microbes, but that your body's good at repairing it. You say we're made for this, not a problem. So I have a genetic BRCA2, which means that I have a DNA repair, double-strand damage repair deficiency. So would I need to avoid ozone on account of that?
I wouldn't if it was me. I'd be doing it. I'd be doing it on a regular basis. Now, she raises BRCA. Angelina Jolie chopped her breasts off. I talked about this on Facebook, and I feel bad for the woman. She's a class woman, and I'm speaking now with love. And she did it because she was scared to death because family members have the BRCA1 gene and got cancer. Let me share something with you. I wouldn't have done that if it was me. Here's why. The BRCA1 gene is not just in your breast. It's in every cell of your body. Why don't people who get cancer all over the place? In other words, breast cancer, ovarian cancer, lung cancer, brain cancer. You don't. Only 1% of cancer cases are multiple organs. So, and I wrote about this because, in my opinion, she made a mistake. You've got this in every cell of your body, so every cell of your body is vulnerable. Rather than start chopping off parts of your body that are likely to get cancer, if you chop off your breast, they're likely to get cancer, but that breast cancer would suppress the other cancers once you get it. Now you're not going to get breast cancer, so maybe you're going to get pancreas cancer, or lung cancer, or another cancer, because you only get one cancer at a time. So that's my opinion. Does everybody understand the logic in this? If she protected herself from breast cancer by doing a double mastectomy and she took out her ovaries, she's not going to get those cancers. But there's a lot of other organs where she can get them. And the breast cancer she might have gotten ain't going to be around to protect her from getting the other cancer. So it remains to be seen what happens to Angelina Jolie and other people. And it also doesn't mean she would have ever gotten cancer to begin with. Howard and I have talked about this extensively. I would be doing ozone a lot. I'd be an organic raw food vegetarian to the best extent possible. I said possible. Get plenty of exercise, meditate, and do everything that you know is right. There's an integrative health institute here. That's where this type of medicine comes in.
And ozone won't hurt you in terms of repairing the damage it does.
Ozone doesn't damage DNA.
Okay, it damages the cell membrane.
In our bodies, aerobic cells, it might ding the cell membrane. It might ding it, might scratch it. And then the cell repairs itself.
Not the DNA.
No, it doesn't get to the DNA. If anything, it improves DNA functioning.
I know a lot of people who are having problems with fatigue. They don't know what it's caused by necessarily. And also a lot of people having trouble with brain fog. So is ozone therapy good for those things even if you don't know what's causing it?
Well, think about this. Why do people have depression? Why do people have brain fog? Why are people's brains just going like this? It's not a deficiency of SSRI drugs, which induces suicide and mass murder. It's not a deficiency of diazepam or some other drug. This is my professional opinion now, and I'm entitled to it. I believe it's a problem with the brain's ability to make energy so that it can make the neurotransmitters and work properly. And if we can get the brain cells and the neurons online and their mitochondria are working and making energy, the body will do better and the brain fog will clear up. Now, maybe the brain fog is caused by other things too. It could be caused by inflammation in the brain. Maybe your blood-brain barrier is wigged out because of subclinical infection. germs making bad stuff in your gut, coming into your system, breaking down your blood-brain barrier. There's so many things that can do this. Maybe it's mercury poisoning, for God's sake. In Alaska, I treated 2,000 to 3,000 people for mercury poisoning from their amalgam fillings. And we got virtually every one of them better by getting their amalgams out and treating them with nutritional supplements, not drugs, to bring the mercury down. And their brain fog cleared up. Now, in the case of the woman we saw yesterday, that wasn't mercury. And mercury isn't going to, treating it's not going to get it better instantly. That's going to take weeks, maybe months. This woman's brain fog cleared just like that. So that means that there was an energy problem in her brain. That's how I see it. For it to be that fast, it had to be energy production. We got oxygen into her system, better rheology, better blood flow, modulated inflammation, and her fog cleared. I tried desperately calling her all day today to get a report to see how, and I tried 6 times, and I couldn't get her because I wanted to tell you. But I've treated autism. I had a kid come into my office in Alaska who was destructive beyond belief. He had to be basically hogtied to prevent him from destroying my office. He was about 6 years old. And the parents consented to getting oxidation therapy. I think at that time I might have been doing ultraviolet on that kid, and maybe a little bit of ozone, but more ultraviolet. After 5 sessions of hog-tying this kid, wrapping him up in a sheet to do this, to get to his arm, he walks into the office like this. The following year, he was in a normal school 1 year behind, and his father was very proud. And this was basically oxidation therapy and a few supplements. We've got another one we're doing right now, and this kid has a lot of STEMI behavior, and his father told me after a couple sessions he's about 20% better. Anything is good in a case like this. It's inflammation in the brain, and we're attenuating inflammation when we're not using chemicals.
Do you treat it with intravenous?
Yes.
Okay.
Absolutely. I don't think rectal will hold a candle to what we do with intravenous. Howard will tell you the same thing.
I've had, I don't want to treat him for free. I've had a half a dozen or so autistic children in his patients as young as 4 years old. As long as they'll take it in their, an IV in their arm, takes only a couple of minutes for a child. You see some amazing results. The parents are always happy. They get better focus. Some of them will actually start singing. They interact with other children better, and where normally they don't interact very well. Now, these are the kinds of things that you get back as reports. It's very rewarding. Emotionally, I don't like dealing with autistic children. It's just a personal thing. It upsets me to see them like that, and not being Jesus, I can't heal them just by waving my hand over them. So it upsets me a lot, but I know the results that you can get with the therapy. It's pretty amazing.
Again, there's a question over here. I'm going to tell you again and again and again, and I think this guy, having treated many thousands of people, will tell you the same thing. Ozone does more for more conditions than everything else combined, except proper diet, nutrition, detoxification, and stress reduction. Would you agree?